All right, we know we have a lot of people joining us today, so as people are joining us, I will start us. My name's Corinne Waldow, and as it has been for the last year, I want to welcome you to the cross-industry update of the Boulder County Public Health cross-industry update around the pandemic. I work for the Boulder Chamber, and we've been happy to host these for the last year. I think we're on session 200 in a partnership with the Latino Chamber of these types of updates since April 30th of 2020. In essence, this is our last regularly scheduled update. We may have as needed sessions if there are confusions or updates or some things that need to be communicated, just for your reference, but this is our last regularly scheduled update. We will continue to send out the emails. I know that I get a lot of responses and questions from those emails. We'll send out emails as updates come out. And I know that there will be some additional pieces that we're not able to answer today because there are a few uncertainties still out there. So we will get started by handing this over to Lane Drager with Boulder County Public Health. We have a special guest today too. We also brought back apparently Jesse Rounds for our final session. He's going to ask 100 questions. No, I'm just kidding. He's here to be with us today for our final session. But Lane, why don't you take it away? And then we'll do questions like we have been every other time. If you put them in the Q&A, I'll ask them on your behalf. I did receive quite a few via email that we'll ask Lane and Jesse when we get to the Q&A time, and we'll try to answer as many as we can during the session. If we're not able to answer them, we'll follow up or answer them via email. Thank you.
Thanks, Corinne, and thanks, Jesse, for joining. It didn't seem right to end all of our webinars without Jesse at least being a part of it. So thanks for joining, Jesse. We're going to go through a lot of what we've done to share where we're at, what the epi data looks like, and do our best to share. Corinne talked about uncertainty. I don't know that anybody could ever expect certainty in this world. So yes, we are still probably facing some uncertainty, but to what we know, we will happily share. So let's jump into it. This is, again, where we're at. We're under this sort of modified level of blue, at least until this weekend. And these are counties that have added additional requirements beyond what the state has. So all the state has the baseline of the state orders. And so that's important for everyone to hear. And I'll touch on that again a little bit later. But the data that you're used to seeing week in and week out, here's a very encouraging one, that our incident rate has finally taken that big drop that we had been hoping for. And that's largely due to our vaccination rates being successful. So this is great, and we hope to see it continue to drop. So kind of really good timing that we finally get this big drop, as we're hoping to sunset a lot of our efforts. Positivity, big drop as well. So again, we were over 4% and even over 5% in the last month or so, and now dropping way down again in 2.5% of positivity for our testing. So this is really good. Hospitalization still, unfortunately, has not dropped. And largely, this is the variants that we're seeing now, that those people who are getting COVID now are getting more ill than people have in the past, and some of them hospitalized. So this really is the big push of why you need to be vaccinated, because we're not seeing hospitalizations from anyone who's vaccinated, and very few even break through that actually get ill. So the vaccines work, and you really need to get them. So this is, again, that exciting piece. So this long journey of where we've seen the illness go, and we're finally seeing that big drop off, which is, again, very, very encouraging, and hopefully continue to see that. We're down to 37 cases per day case count. And again, hopefully that will continue to drop. Here's kind of that demographic breakdown for our communities. Still seeing a little bit more in Longmont. But 59 cases in the city of Boulder, 126 in Longmont, 39 for Lafayette, Louisville, and Superior, and then 34 cases for our other municipalities and our unincorporated county. This is what our kind of disparity tracking looks like, where we're seeing still about 75% of the cases have a known race or ethnicity, and kind of what that breakdown is within our Hispanic Latinx community. Again, still seeing more representation than what that population represents as a total within our community. This again is that breakdown, but again, still happy to see that trend is dropping overall in where our cases are. But in the last 7 days, 39.5% of our cases have been among the Hispanic Latinx community, whereas that community is only 14% of the overall population. So still seeing that concern, and that has been a rise in the last few weeks from where it was when we actually started to see that drop off. Part of that is when we look at get into our vaccination breakdown, is we're still seeing disparities in vaccine distribution amongst our population. But very exciting. In this one, actually, we are now over 70%. So this is huge to see 70% of our population vaccinated. So that's really great. And that's, again, why we're seeing our numbers drop. So that isn't a magic number, but it is very correlated to a significant drop in disease. So we hope to still see it get over 80%, but that last push is going to still take some work. Here's kind of the age demographics where those targeted needs still to increase our vaccinations will be. If you haven't seen the news, we now have Pfizer availability for 12 and up. So that's going to be a huge push to get those middle school, high schoolers vaccinated. And we certainly hope by later this year that it drops even further as far as what ages are available. But still that 20 to 29 at 50%, would like to still see that grow quite a bit. Otherwise, the rest of our age demographics are at very high levels. We'll still try to fill in where we can, but really that 12 and up, that 12 to 30 is really the big target group, as well as then where we're seeing some disparities amongst the age groups for our BIPOC population. So we still have a pretty significant difference across all the age demographics. So we will still track that across the county and for the vaccine clinics that our organization is targeting, doing that, but we're still seeing a lot of availability of vaccines. So that's really pushing people where they can to these various providers that do have vaccine in the community. Just to give you a sense of where things are at within the metro area, we are overall in the metro area at 63%. Again, we're very happy that Boulder County is over 70, but overall the metro area is doing fairly well and continuing to come along. Still want to make a plug. So if you need that information, that state website on where you can get clinics, that's by county. Our information on our website is for Boulder County, but here's information that you can get that applies statewide. I'm going to switch gears now into the complex world of state orders. And so our mask order, believe it or not, is a little bit more simplified than the state, but just as a frame of reference, we are not allowed to be less stringent than the state requirements. We can be more stringent. So that was one option of we could have just maintained our existing mask order, but it would have created those pressure points of, well, how come the state is allowing all these different things and Boulder County won't? So there was a concession to try to align as a metro area with what the state created. And it is a complex thing. So try to boil it down into some buckets. So we have areas that have been delineated that are still sort of higher risk settings. And again, this is through June 4th, and it may be extended. That's still under discussion, but things are still fairly similar. You need a mask indoors in any of these kind of high risk settings. So it's really those that are client facing, customer facing, child care facing. So our schools, child care, grocery stores, restaurants, jails, congregate housing, healthcare settings, limited healthcare personal services, all those where there's close contacts, you still need to have a mask in all those settings. So for that, it's really the same mask order that we have had. Now the nuances of where potentially you don't have to wear a mask. And this really is left up to the individual businesses to decide if they want to do this or not. It is not a mandate that you must now have unmasked people in your businesses if you qualify under these lower risk settings. So these lower risk settings, again, those ones that were not included in the previous list, when you have a small number of people, which is 9 or fewer, you do not need to find out their vaccination status, and they can be unmasked indoors. So this is really office settings, potentially gyms if they're, again, limiting occupancy, some of these other types of businesses that weren't named in the previous slide. You can also still have 9 or fewer individuals that you don't know their vaccination status, plus an unlimited number where you do know their vaccination status. So that's, again, the trick is you will need to know people's vaccination status to still have 9 people that you don't know their vaccination status. And that is really the rub of this order, is how do you know that, and how are you going to go about determining it? And that falls back onto the businesses to verify that they know the vaccination status of all those who are enable them to have 9 or fewer people unmasked. Again, very, very challenging. Once you get to groups of 50 or more, you're going to need to have proof and documentation kind of a vaccine. So you're going to need to go through as a business and either look at everybody's vaccination cards or some way that you're verifying their vaccination status in order to have these larger groups where you still have 9 or more unknown people that are unvaccinated so that everybody is unmasked. Again, very complicated, and it's a management issue back on the businesses. You still need to have signage talking about the need for masks. Again, I don't think you need to change it and have all these crazy caveats in there, but just keep the existing masks, and I think that would work. There was a chart that was created, so this is an attempt to make it a little bit more simplified of when you can have this many people and when you need to move from just asking are they vaccinated to an actual proof where you're seeing a vaccination card or something like that. So again,
Lane, before you move on, this is just for the non-public settings, correct? This chart, this is not for the, this is not for any of those. I get this question a lot. This chart is only for those private settings where they can take those exemptions on the vaccination. This isn't for the retail or any of those people that were in that public setting piece.
Yes, this is all the low risk, and I've got a few more slides to try to help. Again, what's low risk, what's high risk. But that first slide that had the listing, all those high risk settings don't get this as an option. So a grocery store isn't going to be able to unmask people and try to card people as they come in, and same with retail and restaurants and on and on. That's for private events, you know, things like that, where they're controlling the number of, you know, guests, and they actually have an ability to find out vaccination status. Offices where you're able to inquire from your staff, things like that. But these other public facing events, none of this is available to you. So again, this chart is trying to break down how many people can be in your setting that are either unvaccinated or you don't know their status, and then how many, you know, obviously that you've verified proof of, or at least have asked for their vaccination status. So hopefully this is a little bit helpful for this crazy order.
Since instead of waiting till the end to ask this question, when we say vaccination status, and when you read the order, that's 2 weeks past their second shot, correct? So the definition of being vaccinated is that they have to be 2 weeks past their second shot, correct?
Correct. So fully vaccinated. And again, depending on what type of vaccine, if it's Johnson & Johnson's, that's a single dose. So you're 2 weeks past your single shot. If it's Moderna or Pfizer, you have to have 2 shots. So it'd be 2 weeks post your second shot. And that vaccination card should show all of that, and it should show dates and have all of that. And honestly, even in those smaller groups, 49 or less, I don't know if you're just going to be comfortable asking people if they're vaccinated, or if you're just going to say, whenever we're going to move in this world of being unmasked, we're going to want to know that people are vaccinated. It seems very challenging and dynamic for settings where you might have people coming in and out, even if they're not considered high risk. How are you going to manage who's vaccinated and not? Again, there's no requirement for you to follow all of this. You can just say, we want people to be masked indoors, and that's how we're going to deal with it. That's totally your decision. All right, so try to give you some question answer, like, again, that discussion point. So what is a lower risk indoor setting? So here's just some examples. This may not be all inclusive, but it would, if you're, again, very similar to this, this is where it can apply. So it's really those office areas that are not public facing. So it's just the employees are allowed in there. There's no clients that are available, or the general public can't just walk into those spaces. Those would be settings, fire stations, law enforcement offices, all kind of events where you're, again, controlling the groups that are going to be there, where you have either reservations, you're selling tickets, and there's a process where you can now establish who's vaccinated. Those would be settings that you could also use it. And then again, any, I guess, probably similar examples that maybe not be covered here that are not obviously called out as high risk settings. So gyms would be one, and this would require either them limiting their occupancy. If they're a small gym and they're going to just keep it under 9 people at all times, they don't need to ask for vaccination status, and those people could be unmasked. As soon as they want to increase the numbers, now they're going to need again, a reservation system or some way to verify who's there, who's vaccinated, in order to be unmasked. And that's per room. So if a gym has multiple rooms and you're limiting it to 9 per room, that would be another way where you could do it. It's just would be then the larger congregate spaces, you would either need to manage it or have people wear masks. For the most part, I think schools are gonna likely want folks masks. So I don't know that, and this is probably not a lot of folks on there. And similarly with jails or healthcare settings, if they do have an office component, that would be their decision if they want to manage it that way. But I think a lot of those that do have, student facing, public facing, it is difficult to just delineate who's going in and out of the office back into those other settings, and then changing whether they're wearing masks or not. But those are some additional policy. Certainly we want to see all those areas where they're public facing, people still wearing masks. Live performer. So when you're thinking of settings where that's going to be, if all your audience is masked, then you can have the 9 performers be unmasked. So that would be a way where you still could do those types of things. Again, once you're starting to get to a place where you're going to have unmasked audience, now you're going to need to have vaccination status in order for both the performers to be unmasked and the others to be unmasked. And then again, you're limited to those 9 people that would not have the vaccination status. So obviously if your performers are vaccinated and you can verify your audience, now you've addressed it. But that will be a management issue for settings that are looking to try to do that. We really want to see everybody who's able to wear a mask, again, 2 and up, even though the order doesn't require those younger ages to do it. It's still important, and we still need people to do it. And it is helping us prevent disease. So there's a lot of people who are questioning the efficacy of masks, and it has been incredibly impactful to prevent disease. It's both impactful on the COVID front, and it certainly has also impacted all the other respiratory diseases we seasonally see, like flu. So there's plenty of data to show that masks work and are effective. And so they are still an important tool for us. Why is this so confusing? Well, that is a great question. I can't tell you the rationale beyond, I believe the state was trying to drive people to become vaccinated. That's why they provided all these different allowances for you to be unmasked if you were vaccinated. So that was, I think, an attempt to create an incentive program for people to be vaccinated. So hopefully it did that, because it is definitely confusing. And again, we could only be more stringent. We can't be less stringent than the state. So we felt we wanted to at least try to provide some additional incentives for vaccination and give some businesses who felt like they could manage this an ability to manage it. But for those that feel like it's too crazy, feel free to just default back to indoor masks. That certainly is not, that is certainly an option you have. Any other mask questions before we, because we're almost out of our slides anyway, but it's probably a good time. That way I
have a ton of mask questions. So do you want to just move through and then we'll come back?
Okay. So the other things are really just some of those reminders that we've shared around our notification system, or the, not ours, but the notification system that was created. That's still a helpful tool that we will not likely see an end to actual disease for quite some time. And again, the variant cases are still seeing more disease come from those folks. So again, really need people to get vaccinated. This is likely our finale. We will see. We are anticipating the state to do something more related to an order, whether it's an extension of their existing order or some reduction. But while Boulder County is not anticipating putting an additional order in place as of this weekend into next week, we would still be subject to whatever orders are in place in the state. So as of right now, there still is a state order. We just have one that's more stringent in Boulder County on what we were doing under our kind of modified version for the last month. But we don't have any actual information on what the state's order will entail. And so it's kind of fitting, as we were planning to end and thinking all the orders would go away, that the state surprises us with the likelihood of another order. That being said, that order is likely only going to impact those venues that host sort of larger indoor events. So that right now is under kind of a state requirement that if you're trying to host events more than 500 people, you need to have a state review and approval. So that is something that we think the state might continue. And so that would be probably the most significant part of the order that will potentially continue. And so if that really is all there is, we don't necessarily think we'll need another session next week. We would just, blast that out to all the groups that have been attending. And then certainly if you're an event facility, that would likely be something that still impacts you. We do not anticipate having any review or approval processes at the Boulder County level. We were planning to move to clear. And so we were planning to remove all of our orders minus the mask order. And that's still our plan, but the state might still have an order again, which means by default, the county has an order as well, because we are under the state order. So while we were feeling like we were done with all the confusion, there's likely still a little bit left. Again, hopefully it's just for those event settings and it doesn't apply to any of the other sectors that have been under all the various components that they've been under for so long. So all of those should be gone.
And just to be clear, when we do get final order, the state order, as the county moves to it's, taking away their order and the state order, if it's about events, I'll send out an email and I'll try to delineate as clearly as possible what it means and who it impacts, as I've done in the past. Can you talk about what, I know you won't be able to tell what the state order says, but I get a lot of questions on what clear means. I mean, I think I've gotten at least 25 of them via email today. What does clear mean? What is clear? I mean, is that if you're removing an order, what does that mean for distancing between yoga mats or taking temperatures of my employees or my guests? Can you just maybe go into a little bit more detail about what that would mean?
Yeah, so the next phase that we're moving into was really now just monitoring disease. So we are not imposing all the different restrictions on operations for business sectors. We would still encourage you, all the practices that have helped you prevent disease are still effective practices, and we encourage you where you can implement them. But all the spacing, the limitation on occupancy, all of that is not in place anymore under clear. So we are just continuing to monitor our disease, ensure that folks that are sick are isolating and those that are high risk are quarantining, and then making sure our hospitals don't see surges and get overwhelmed. But we're not in the role of now putting all the different requirements on the business sectors to monitor their employees. We would encourage you to still do that. Those are good practices outside of a pandemic. Is when you have sick people, they're not good to be around other employees and other clients because diseases are transferable. So those are still encouraged things, but none of them will be required outside of the mask order.
So mask order, dial, two separate things. So if we move to clear on May 16th, minus whatever the state order is, we'll keep that separate right now, move to clear, moving 6-foot distancing requirements, removing the requirements that you take temperature checks, removing the requirements that you do certain cleaning, all of those things that have been dictated and required of businesses up to this point will now move to recommendations, and it now moves to businesses. The onus is on the business to decide what safety measures they want to take. At this point, knowing what all the social distancing, all of those pieces were the recommended measures to help mitigate the spread of the disease. So we have a lot of questions on this. So I just want to be clear that clear means that now these are recommendations minus the mask piece. These are recommendations, not requirements.
Correct.
Okay, and that would ideally that would be a move on May 16th if we stay below the 2 per 100,000 hospitalizations here in Boulder County, minus whatever the state order is that comes out, and most likely that's in the event space.
Yes. You know, the other thing I wanted to just briefly mention, so obviously with these orders sunsetting, our business support team is also going to be sunsetting. So as there's ongoing questions, you know, we have our call center, but we're not anticipating any additional orders from Boulder County. That state order is going to be likely very limited in focus on what businesses will impact it, but it won't be something that is a Boulder County expectation for approval. If you're doing a large event, you would have to get approval from the state. And so we would not expect to be reviewing those, very, very unlikely. That being said, the state may have a caveat that requires us to do that. So we're going to wait and see on that. But we will share, you know, contact information of how to provide that to us if that's still required. We do have our website that has all the different information. So that's the link here. That's our Boulder County COVID page. And then at the call center will likely stay in place. That also will be transitioning. So sometime in June. So more to just our community resource navigators for those folks that are still needing support. So we will likely be sunsetting a lot of that just because, again, we won't have any orders. So there won't be any requirements for people to have questions about. So it's really just down to the mask component at this point.
Okay. And I'm not going anywhere, just putting that out there. I know a lot of you still have my email and phone number, and I'm not going anywhere. I'm available to support in the capacity that I can. All right. Oh, when do we expect the state to provide the direction or its order?
I wish I had it so that I could share it with you now. That was something that we had hoped. Maybe tomorrow. That's one projection. Likely, certainly by this weekend, which is not as helpful. So But we're strongly anticipating that they're going to do something. The fact that there's this much back and forth dialogue seems like the state is going to do something. So, and unfortunately, they have not shared what that is. So.
Okay, I'm going to get into the questions, but before I do want to, before everybody drops off and before we get into the questions, I want to personally thank Boulder County Public Health. Jesse and Lane are on this call, but behind you are, I think, 15 to 20 people that have served on this business support team at one point or another, that a lot of counties don't have. And we've provided this opportunity for businesses to interact directly with Boulder County Public Health. And you've made yourself available, whether it be answering emails or being on these calls or having a call center. And I want to thank you. I want to thank you for making yourself present and available since April of last year, March of last year, for businesses in our community. And I really, truly believe that we've helped mitigate the spread of disease, and we've helped as many businesses as we possibly can. We've had thousands of people interact on these calls. We've had 200 sessions. We've had 6,000 people participate, and another, 7,000 people watch the videos. So I joke that it's the Lane, Corinne, and Jesse show, but at times I think that I want to thank you because you've made yourself available for businesses in our community. And, I've heard from other counties that's not the case. And I want to say that before everybody drops off. And now I'm going to go to the questions because we have a lot of them.
Yeah. Well,
so
we do that, there's a reason we've had these, and it's you. And so you've been the central person. So of those 200 webinars, you have been on the most of all, more than Jesse, more than I. So we applaud all the work of the chamber and all the chambers that have come together to share and communicate to our community, because you are an amazing force, Corinne. So we appreciate you so much.
Thank you.
I want to second that, definitely.
And Jesse, hey Jesse. All right, so let's go. Let's go into, all right, we move to clear. Let's say we move to clear. Let's say the state order is just around events or something like that. Do you still have to report an outbreak, and what do you do around quarantines?
So the disease mitigation piece is not likely going to change. So as far as if you have sick people, they need to isolate. Those high risk exposures are going to need to quarantine. So again, those are the components that have been happening maybe a little bit behind the scenes. People aren't always seeing that. That is still going to continue. We're not out of this disease at this point. We have a really good vaccination percentage in the community, but there's 30% of our community are unvaccinated. So there's still plenty of people that are eligible to get sick. And with the strains that we're seeing, the likelihood of them getting sick is even greater than it was, previously in the pandemic. So there's still that potential. So encouraging your staff to be vaccinated is one way to prevent it. So yes, those kind of mitigation steps are still going to happen for the diseases that still occur.
So saying that, so if you still have to quarantine, if you are exposed to the virus, if you still have an outbreak, you still need to report it. You're no longer required to do employee health checks if we move to clear. Is it still a good thing to do, because it'll really lower the amount of time you have to close if you were to have an outbreak, if you know who's working around whom and you're making sure employees aren't coming in sick. It might still be a best practice while COVID is still in our community to be able to trace some of your employees' contacts with each other, correct?
Absolutely. So there's sort of two worlds of this disease. There's a prevention world and there's a reaction world. And so all of the orders have been efforts to prevent disease. And then unfortunately, there's either sometimes people aren't doing it or disease still is happening. Then there's the whole reaction world, which is isolation and quarantine and closure and outbreak requirements. So that's all on the side of now trying to prevent further disease, because we already are seeing these outbreaks happening. So all of your efforts to do prevention will prevent you from dealing with the reactionary side. We still have powers if we need to close businesses if we're seeing significant outbreaks. So again, nothing we want to do, but if there's significant disease happening, that's our role, is to prevent that from continuing. So, so those prevention steps, they have worked and they will continue to work where you voluntarily implement them.
I was talking to somebody today on a call, and we've had this culture of, I'm going to power through, I'm sick, I'm still going to go to work. And I'm hoping this pandemic has taught us something about that. I'm not going to go to my exercise class today. I'm not going to go to work when I'm sick, because we know the spread of disease is not a good thing. It can happen. And look at a pandemic and how it shut down our community and our economy for so long. Now, you mentioned the 70% vaccination. That's just 70% of the eligible community that's vaccinated, correct, right now? That doesn't include children.
That's a good question. So some of those demographics that we were showing represent the age demographic. So when you look at, say, 10 to 19, it's including all of that 10 to 19, but we know that until recently, it had only been 16 and up that were available. So that's part of, let me go back to that slide. That's part of why that number is so low when we look at our age demographic. So 10 to 19, only 20% of that age group is vaccinated. Well, we know that 10 to 15-year-olds weren't eligible until this week, and now it's only 12 to 15. So 10.
But when you're going along and you're comparing against the other communities and you show that we're at a certain percentage, I believe that that number was of the eligible population, correct?
The one that's the whole metro area.
Yeah.
Those would be similar percentages as all these. So this 10 to 19, that's all of, so 10-year-olds are not eligible. So there's 0% of them vaccinated, whereas 16 to 19, we're at actually about 40 some percent of those vaccinated. So that total creates that 10 to 19 at 20%, whereas 0 to 9, 0% are vaccinated and 0% are eligible. So they're included in these categories. The overall vaccination rate of who's eligible is what you're talking about. That would not include 0 to 9. That would not include those ones. But for these, it is including them. So again, it's a, hopefully that will change in the future, but unfortunately these are the breakdowns that are, I think, most manageable for our data folks to work with. But yes, so some of the numbers do include folks that are not eligible in them, like this.
So let's keep it up on this. And we know that right now they just opened up 12 to 15. And I know I got an alert saying that my children can now make a vaccination appointment. When we're looking at this mask order that says 80% are vaccinated, if you have children entering, does that include children? So if you have a large population of children and they can't get vaccinated, then you're probably not going to hit your 80%, correct?
Correct. And typically those are going to be settings that wouldn't be eligible anyway. So again, when you look at high risk settings, that should include almost anything that would include children outside of a private event. And then that private event, so if it's a private birthday party, you're not going to be able to have 20 unvaccinated kids unmasked. So.
All right, so let's move into, we have a question about, are you breaking HIPAA laws by requesting proof of vaccination from employees? And I sent you the answer to this week too, but I got an answer on that from Employers Council, and I was sending it off to individuals. But it's not a HIPAA issue. HIPAA would cover information that the employer learned from the health plan provider. Technically, by asking if someone's vaccinated, you're not breaking HIPAA. It's if you start to ask additional questions, things like why, what medical conditions. So by just asking their vaccination status, you're not breaking HIPAA. You're not violating HIPAA. If you want additional pieces to that, I will send it out actually in the next email. The EEO's Q&A website, I'm going to send out the actual answer to this question from the EEO's website about whether or not it's violating the ADA, HIPAA, all of those pieces. But by asking vaccination status, just that one question, you are not violating.
And I think it's important, if you have legal questions, you do need to get legal advice. So public health cannot provide that to you. That being said, you should ask the question, is your business subject to HIPAA in the first place? And so not every business is subject to HIPAA. So it's important to know that. It's certainly, if you're gathering and collecting health information about people, then there is protection for that. But again, asking people if they're sick, that's not a HIPAA violation, but getting into medical conditions and medical records, that's a whole different world.
And the real question here is it a violation of ADA in some cases? And that's where I'm going to provide the answer that came from the EEO's website. It's when you start to ask additional questions in addition to their vaccination. So I will send that out. So are masks required outdoors regardless? Are they not required outdoors regardless of social distancing?
Correct. That's not a requirement in the current mask order. It's only an indoor mask order at this point. That being said, if you're going to have a large outdoor gathering and people are not social distancing, the risk for transmission didn't change. Just our vaccination status has improved. So otherwise, if you have unvaccinated people and they're not socially distancing and not wearing masks, they can transmit disease. And that's why we still have cases happening, is, we're still seeing people interact in different settings and still transmit the disease.
All right, we have about 12 questions that I'll ask the same thing. How does the mask order get affected by the CDC's guidance that came out today that said that vaccinated individuals do not need to wear masks indoors and outdoors?
Doesn't change any of the orders. I think that was the premise the state was trying to get to with their order, is certainly if you have vaccinated people, they wouldn't need to be masked. They were looking at rough projections on herd immunity with their percentages. But, when people are vaccinated, their risk of disease is really not there. But there's not necessarily a prevention that you can't get the virus and give it to someone else. So as far as, being vaccinated and you not being a source of making other people sick, that still is possible, especially for being around unvaccinated people. But the challenge is, how do you know who's vaccinated, who isn't? So the idea that, yes, when you're vaccinated, that's great, but people will just say they are and they may not be. So unfortunately, the trust and honesty isn't 100% in our world. And so, but it's a valid statement as far as your risks when you're vaccinated versus your risks when you're not. But our mask order isn't going to change. It already has components related to vaccination status versus unvaccination status.
So even though the CDC guidance came out today, that doesn't change the state order, that doesn't change the local order. That's just guidance that came out. And the state and local order kind of address that in some way by creating some controls that allow unmasking in private settings for large numbers of vaccinated individuals.
Right. I mean, when you look at the metro area, 38% of the metro area is not vaccinated. So how do you know who is and who isn't vaccinated? And we know that a large number of the people in our Boulder County community that work there don't live there. So when we look at vaccination, looking at the metro area is a better gauge of who might be in our community and what their vaccination status is. So again, the fact that Boulder County residents are at 70%, that doesn't mean everybody in Boulder County community at any time is at least 70% vaccinated.
And then the mask order and the dial clear, those are separate orders. The mask order is in effect now. We're not waiting till June 9th or June 5th for it to be in order. It's in effect now. It's a question. And even though we're getting rid of some of the mitigation efforts that dictate mask usage within the dial, the mask order does have a lot of those pieces within it. So you need to look at the mask order within your areas to decide whether or not you need to continue having a mask even when the dial goes away, correct?
Correct. The mask order is its own standalone order. The dial order is the one that's talking about your screening of employees and how many people you can have in there and the spacing for your tables in a restaurant and on and on and on. That's what the order that will sunset on the 16th.
And the mask order did try to take into account the personal services and the removal of a mask when needed for a procedure or performances. So they did try to incorporate some of those pieces within the dial, within the mask order that were dictated under the dial. Okay, do the people room matrix. So that matrix you had up, that private event, and I did send that out in today's email. But by the way, someone asked if I could send out that chart that's actually in the order. So any link to the official mask order from Boulder County does have that chart that he shows. And this is for not high risk public settings, but for private low risk settings. So go to the chart, the 0 to 10. And so this chart right here, I did send that out today, and it is in the order as well. The question is that, does this apply to things like weddings and private meetings and so forth?
Yes.
Okay.
Any life rights kind of ceremonies, things like that, it does apply.
Now, when we look at when you're talking about performance, so we talked about the performances and you said, 9 or less performers, unknown vaccination status, they can take off their masks. Is there a distance requirement for those performers? Now, there is a distance requirement up until May 16th because we're still under the blue dial, but after May 16th, is there a distance requirement?
No.
No.
Nope, just the wearing of masks is the only requirement. That being said, we know that unmasked people, unvaccinated people that are less than 6 feet, there's a risk of disease. So it doesn't change the risk for people to still make each other sick. It's just our focus has always been on making sure our healthcare system doesn't get overwhelmed, so that when you go in for some illness, not even COVID related, there's a bed for you to be seen and helped and get better. And so that's really the focus. It's not to say we're going to get to zero disease, because if people stop everything this weekend, there'll likely be an uptick because there's still a big chunk of people that are not vaccinated.
And just a reminder for everybody, we're in blue until that order sunsets this weekend. So you still have to take temperatures for your clients coming in for personal services. There's still the distance requirement for performers up until that point. After that, it's the mask order and then whatever state order is happening. So when we talk about this, some of these, it's moving into that clear area. That's not until after May 16th.
And for you to still ask your clients those things and do those, it still will have a role in preventing disease, but you're not mandated to do it.
And things like, the fact that waiting rooms, do businesses like personal services and limited healthcare, can they open their waiting rooms, or do they have to continue to have virtual waiting rooms? In clear, those can open up again.
Yeah, I know it's hard to go through every nuance that's been in the orders and say, no, it's not there, but no, it's not there. So anything that you read before, the only thing that we have is the mask order, and then whatever the state order entails, which again, we anticipate it's just going to be the components related to approvals for larger indoor events. But
I'm just trying to group some of these together. I get a lot of these questions, like clear. It's so hard. I totally understand. For 13 months, every part of your business has been dictated by some sort of piece of the order. You need to take temperatures. You have to have 6 feet between this. You have to do this, and then to move to a period where you mean my tables and I don't have to do this. My waiting room can be open. And now, reminder that, when you say recommendations, may not be good to have a full waiting room of people, even when even after May 16th. So recommendations are, maybe if the virtual waiting room was working for you, you continue it for a little while, or you have every other seat closed off, or you have families just sitting together. Maybe that's a continued recommendation, but it's no longer a requirement. You as a business make that decision on what tactics you are going to use to mitigate the spread of disease.
Yeah, I would expect that depending on the setting and what you're, if you make a radical shift, it might not instill confidence on your clients or, who you're trying to attract for your business. So these things, are helpful at preventing disease. So it's up to the business now to manage that. And short of it creating a significant outbreak or communicable disease risk where we would have to come in and intervene, which again, we would hope not to have to do that.
So under the mask order, it does call out public areas of state government facilities, county or municipal government facilities, and areas of such government facilities where members of the public come into contact with government employees. Does this include municipal facilities activities that are operated by the Parks and Rec departments that are like rec centers, gyms, and indoor fitness classes? Those areas, Jesse, you just came on live. You're wanting to answer this one, aren't you?
Well, I mean, Lane is the best person to answer this question, but I've been talking with the Parks and Rec folks pretty consistently. So Lane, if you want me to.
No, go ahead, Jesse.
Okay. So the guidance from the state and our attorneys has been that in certain rooms you could go maskless, but all of the authorities have said, nope, we're not going to do that. It's too complicated to figure out who's got vaccines. It's the same reason all of these regulations are in place now. So the rec centers we've spoken with are all going to maintain masks indoors in any room, regardless of vaccine status.
So even the private office areas in the back.
So they have talked, some of them have talked about private office spaces in the back. But as far as I understand it, they are going to continue to do that.
Well, and a lot of them have a lot of children coming into rec centers and therefore a larger population of individuals that can't be vaccinated. So that might be different than maybe a private yoga studio that it's mostly older than 16 who can't have 9 people that come in at one time, and they can track the vaccination status of those 9 people coming in at that one time.
Yeah, that makes sense to me.
And camps would be, again, separate, like you mentioned. So those would still need to be either outdoors, or if they're indoors, they're going to, fall under a lot of that camp guidance where they're going to need to wear masks.
Is it expected that the new state order will update state mask order under the new CDC guidance, or you expect there's a state order, but there's also the county mask order that's in effect till June 5th. Do you expect the mask order to be updated at all?
Yeah, I don't know exactly what the state order changes will be. I think it might be more focused on, again, the events, but we need to see it. That being said, we wouldn't expect the state mask order to become more stringent. So it would still be under our county order. So, and our county mask order goes right now until June 4th. So again, don't expect any changes on masks until possibly June 4th.
So we potentially moved to clear. Restaurants no longer have the 6 feet between tables. Can individuals take off their masks to eat and drink when seated at their tables and they're no longer at 6 feet apart?
Yeah, so the mask order already allows for that, so nothing will change in that setting. So in a restaurant setting, when you're seated at your table, you don't need to have a mask on.
Okay, let's talk about restaurants and bars. Let's say that you're in a restaurant and a bar, and now that bars are open, when people are moving around, when do they have to have masks on, and when do they not have to have masks on when the social distancing and some of that is removed? I think there's a little confusion around that.
Whenever you're not seated. So that's the only time you can not have your mask on in those settings. So if it's a bar that doesn't have seating, it's not back to normal, I guess, as some of those bars where everybody can just walk around and mingle and be unmasked. That's not provided for in the mask order. Because
restaurants are technically considered public facilities. Retail food establishments, and they can't even get out with the vaccinations or the 80%. They're public facilities and they're under the indoor masking order, except when eating and drinking, seated and eating and drinking.
Yeah, and in fact, now it just says seated. So I think the idea is that you're eating and drinking, but you may not be continuously eating and drinking. So, but yes, so if you put the tables right next to each other and everybody's unmasked, the risk goes up. So that didn't change. It's just that our vaccination status has increased. So there's less likely that those people will both be unvaccinated and one or both might be sick. So, but it doesn't eradicate the risk. So it increases it. So
the new order just says seated. So for example, breweries, tasting rooms, these facilities that are opening back up that were closed due to the requirement of having food and all of those pieces. When you're going to the restroom or you're going to get your drink from the bar, you're going to need to put your mask back on. Okay.
Unless you're outside.
Okay. Let's talk about kitchens. Let's talk about restaurants again. Do kitchen workers still need to wear masks? Servers, are they still under the mask requirements?
Yeah, those are high risk settings. So grocery stores, retail, all those are still subject to the mask order.
Even if they have vaccination records of their employees, they still have to wear masks.
Yeah, because your patrons don't have to show that.
So there is that caveat. I mean, we've had 3 bars now ask, people are standing and drinking. They probably want to provide some seating since the order literally says seated. Okay, so let's say you have let's say you're an office and you have 80% of your staff are vaccinated. Do you need to still maintain that 6 feet of separation between desks in the conference rooms and the break rooms? Of course, we need to separate this pre-May 16th and post-May 16th. What's that distancing look like?
No distance requirements once the orders are sunsetted.
So once the orders are sunsetted, the distancing requirements between desks, in conference rooms and so forth are no longer there. Mask order separate. If you have 80% of your staff is vaccinated, you have proof of that, they can then they could potentially remove their masks. All right. Are there any recommendations for businesses such as personal services and limited healthcare to reduce their cleaning, sanitizing procedures, or should they maintain the same practices?
We're not recommending to clean less frequently, no. But there's no requirement that they maintain those same levels that they were. Outside of if they have requirements under, a regulatory body, some personal services are regulated by DORA and have other requirements. So those still are obviously in place if they have any requirements under their other regulated bodies. But once the order goes away, there's no requirements anymore. But we aren't recommending people stop doing everything. That's not our recommendation.
And to clarify, sunset means that on May 16th, currently we're in dial level blue. Boulder County's to sunset means it lets it run out without putting a new order in place. That's that move to clear. Clear being there's no other order from the county putting restrictions and requirements on businesses. So that's what sunsetted means. I had a question about that. So
yeah, that's exactly it. So we're really in a monitoring period starting the 16th through through August. And as long as, again, our hospitalizations don't become a problem, there's a provision we would put something back in place if that's happening. So
we move to there's no other Boulder County order besides the mask order, and then potentially a state order that would dictate certain areas, and we're thinking that's around events. But again, don't know. I think we've said that more than anything else on these calls. So if we have a live music and it's outdoors, can an audience and band be unmasked?
Yes, they can do that right now.
Right. So, and this is just clear. I know we've probably covered this, but I just want to do it in the way that the question's asked. For an indoor event, if everyone is required to wear masks, so you're not doing the 80%, you're not doing any of that, and there's no food and drink being served, are there capacity restrictions, 6-foot distancing requirements? So up till May 16th and after May 16th, and this may be a little bit of that state order.
Yes, so there is 100 capacity currently, and then if you want to go up to 500, that requires state approval. And that likely is what we think will continue in this next state order. So that's specifically what we expect the state order to address.
So we'll try to get as many details. So when this comes out, we'll try to detail out the event requirements or whatever the order requirements are when it comes out. The current performer distance up until May 16th is 12 feet, correct? The performance distance between the performer and the audience?
25 feet.
25 feet? 25 feet. Between the performer and the audience up until May 16th. And then at that point, that is being sunsetted or going away.
Correct.
Okay.
Yes, for an unmasked performer.
For an unmasked performer.
If they're masked, then there's not a 25-foot separation. So.
Are people allowed to ask to check CDC vaccination cards?
I think this gets back to what you had already shared as far as, can you ask for vaccination status? So it's not a HIPAA protected kind of piece. So that's up to you how you want to move forward. But under the mask order, in order for you to have, 9 unvaccinated people in your group, you need to know the vaccination status of the others, and you have to have proof whenever you have 50 or more people. And the vaccination card is really the only proof that makes sense. So.
Okay. Can we play pickleball without masks right now?
If it's outside, you can do that. If you're inside and there's 9 or fewer and you don't know the vaccination status, that's okay. If it's 10 or more, now you need to know the vaccination status of the 10th and everybody up from 10. So it falls under the chart. So it's possible.
That was like literally the first question that came in today, but I didn't get to it till just now. So thank you for your patience, Kit. I apologize that we didn't get to it now, but it kind of fell into the line. So again, it's part of this because it's that private setting. It falls into this chart that you have up right now.
Yeah, lower risk setting. It may be private or it might be, so it would just be dependent on the setting. So if it's outdoors, yes, the mask order doesn't require outdoors. Indoors, it does. And then based on the number of people and the number of people that are vaccinated or unvaccinated.
If a practitioner or employee is exposed yet vaccinated, do they have to isolate or quarantine if there's an outbreak? Do they need to quarantine if they're exposed?
So high risk of exposure that's vaccinated, it depends on what they were exposed to. Some of the variants, there still are requiring quarantine, even if you're vaccinated, just because of the risk of you giving that to someone else. So you're not likely to get ill. But the vaccines are very specific to protecting you. You can still have the virus and give it to someone else. So it is a little bit dependent, but typically, no. Once you're vaccinated, you're not quarantining, but it will be subject to that investigation and seeing what it is. Some of the variants, they still are having people quarantine because, especially high-risk occupations, people that work with high-risk populations, oftentimes there's still some quarantine requirements there. So
the difference is quarantine is if you're exposed but you don't have the virus. Isolation is if you have the virus. Yeah. So if you're vaccinated and you test positive, you're going to need to isolate.
Yes.
If you're vaccinated and you become exposed to the virus, it depends on whether or not you were exposed to a variant, and that's all detailed on the website, on the state website as well, I believe.
and your role in what you're doing, that's probably even bigger role. So if you work in a long-term care facility and you were exposed to COVID, you potentially might still need to quarantine. But that'll be dealt with on the case investigation side of things, and they will share if that is a requirement.
Okay, can businesses require employees to be vaccinated in order to travel with the company?
Yeah, I mean, you should talk to your corporate or your HR folks and deal with that. But I know that our own research is, as an employer, we can require a vaccination. We already require people to be have flu vaccines in Boulder County Public Health. We have roles within the county that require hepatitis vaccinations, and so you can certainly do your own research, but you can require vaccinations. CU as an employer and as an educator has required their staff and their students to be vaccinated. So, you can explore what you want to do, but that's the answer as far as, when we've looked into, you have the ability to require it. It's up to you if you want to do that or not. And if you feel that you have high risk settings where it definitely changes all of your practices. When you have 100% of your folks vaccinated, when we look at all these different practices that you've been doing, the need to do those isn't there anymore. So the frequency of cleaning, the screening for employees outside of other illnesses, it's still valuable, but you don't need to do these to try to prevent the spread of COVID in your business once you have vaccinated staff.
Okay, we're going to try to wrap up here because I have a few more questions. Are testing sites staying open and level clear, specifically Stasio?
Our testing sites are going to start to close down. I think June, I can't remember the exact date of when those are going to go away. There will still be testing within the community, but some of the larger testing sites are not going to be maintained throughout the whole summer.
So when we have more information on that, we'll send it out.
Yeah, it might be posted on our websites already.
I'll look and try to get that out. All right, one final question, and thank you for your patience, Joanna. Contact tracing. So, what's the current status of the county's contact tracing? Specifically, this person said that they were never contacted when they were in close proximity or had a family member that was tested positive. What's the current status on contact tracing?
I know we're finally back down to a level that we have sufficient capacity to manage. So, but that had not been the case, for a big chunk of this year, is that the number of cases was far in excess of our ability to do the tracing. Now I think it should be, but it is possible that somebody might not have been addressed just because of the volume of cases that we had until the last 2 weeks. I think we're now at an amount that we actually have a sufficient capacity to deal with.
All right, any final questions? I know we went over, but this technically is our last scheduled, but who knows if Lane and I have to do a pop-up one in the future. But again, the emails won't stop if there's updates, mask order updates, state order updates. We'll try to clearly define what clear is and what the changes are coming this weekend. I just don't want to send out too many emails. I want to see what the state order looks like. Let's see if there's any other questions. In the meantime, I want to thank everybody for joining us. We had quite a few questions and quite a few people join us today. And over the course of the last year, we've had, like I said, thousands, and I think you've answered thousands of questions on these calls. So thank you for your patience and thank you for your service, and good to see you, Jesse. I miss you.
Thanks.
I can't wait to meet you in person at some point. I've met Lane in person. I've never met you in person. So
someday.
All right. Well, at this point, I'm gonna close it down and say, if we need to, yeah, we all do need to get together for a drink. Someone just suggested we all need to get together for a drink at some point.
On our agenda.
There's a plan on our agenda, or 3 or 4. I think we all owe each other some drinks. All right. I will talk to people on the emails. And if we see you on another webinar, hopefully that's not the case, but if we need one, we will stand one up. We know how to do it, and we'll get the information out there. In the meantime, you know where to find us. If anything changes, we will send that out via email.
Thank you again so much, Corinne and Chamber, and everybody who's joined and participated throughout the last year. Appreciate it.
Thank you.
Yes, thank you, Lane. Thanks, Corinne.
Thanks, Jesse.
Bye.